I'm joined by Dr. Mary Gordon, a board-certified general cardiologist with Morris Hospital cardiovascular specialist. Dr. Gordon sees patients at the Shanahan, Morris, and Ottawa offices. To schedule an appointment with Dr. Gordon, call 815-705-1000. This is Heart Month, right? And Women's Heart Health Month, specifically,
yes, that is
right?
Correct. Well, I think we should talk about the seriousness of heart disease in women. There's the last couple of years, obviously, we've had a lot of discussion about the pandemic and what impact it has on mortality for all adults in this country.
Sure.
But regardless of the COVID pandemic, heart disease remains the number one killer of women in this country. And 1 in 3 deaths in women will be caused by heart disease. It kills more women than all forms of cancer combined.
Wow.
And something I think a lot of women aren't aware of is it's actually the number one killer of new moms as well. 1/3 of all maternal deaths are due to some form of cardiovascular disease.
Really?
So it's an important topic to talk about.
Sure. Well, wow. That's pretty shocking.
I know.
When you explain it like that with those specifics, wow.
Yeah, and there are some diseases that are specific to females that men don't get that actually increase the heart disease risk for women, such as endometriosis and polycystic ovarian disease. Okay. Having endometriosis actually increases your risk of cardiovascular disease by 400% once you reach age 40. And a lot of women simply aren't aware that those diseases we've traditionally thought about as being female-only diseases actually increase their risk for other things like heart disease.
The old adage about an ounce of prevention is worth a pound of cure, that really plays into heart disease, doesn't it? Prevention is key.
That is absolutely true. Prevention is definitely the best thing that you can do. And recently, the Journal of the American Heart Association published a new study. A lot of people get overwhelmed by the thought of trying to do 30 minutes of exercise a day or trying to get into a regular exercise program. But what they found in this study that was performed over about a 20-year period of time was 10 minutes a day of moderate to vigorous activity, which is just a brisk walk, could save as many as 110,000 lives a year. So if you're over the age of 40, just doing 10 minutes a day has a significant impact on your health overall. And 30 minutes actually saves 270,000 lives a year. So you don't have to do a lot. You don't need any fancy exercise equipment. And, gym owners, please forgive me, but you don't need a gym membership either. You need a good pair of shoes, and you need your body, and you need to move.
Signs and symptoms. Is there a difference of signs and symptoms for a woman versus a man?
Yes. Of course, everybody knows that crushing chest pain is a typical heart disease symptom, and women can have that symptom as well. But women generally do have different types of symptoms. Part of it is because women tend to be caregivers, and so they're always sort of thinking about their family first, so they may not notice symptoms. But the other part is heart disease in women tend to affect smaller vessels, and so it causes a different kind of feeling. So the most common prodromal symptom, or the symptom that women will get in the weeks to months leading up to a heart event, is fatigue. And I don't mean just normal fatigue, but dramatic fatigue. So like something just like making your bed, instead of being a normal amount of tired, makes you exhausted to the point where you have to sit down and rest. Or doing a load of laundry just totally wipes you out for the next hour. That kind of fatigue is something that you should be aware of. Sweating is another one. If you as a woman start to sweat with minimal activity, or at times when you are just sitting and not doing anything, while that can be related to hormones, it can also be related to a heart issue. Women tend to have their pain in the neck, back, and jaw more frequently than men do. Men tend to have chest pain. They can also have neck, back, and jaw pain, but women tend to have pain in those other areas as well. So the symptoms can be a little different. That's why it's important for women to know that they should pay attention to those things instead of just thinking, I don't want someone to think I'm panicking. Come talk to us. Let us make sure that you're okay.
Right. Now, let's say a heart problem is diagnosed. What can one as a patient do about it?
Well, like you said, try the ounce of prevention, but once you're diagnosed, those same things still apply. Exercise is extremely important, and if you've been diagnosed with heart disease, create your exercise program in concert with your doctor. Talk to them about what activities are safe for you to do and what aren't safe for you to do, and develop a plan so that you can gradually work your way into an exercise program that combines 2 days a week of muscle strengthening and about 5 days a week of aerobic or cardiovascular fitness. That's the current recommendation. And then quit smoking if you're a smoker. Don't start if you haven't started. I'm always amazed sometimes that people who are adults will pick it up. But if you stop smoking, it's one of the single best things you can do to help your heart health. And then having your diet change a little bit. So fruits, vegetables, whole grains, and fish are really important, very healthy parts of your heart-healthy diet. Less animal products. So, of course, we live in the Midwest. We all love our steaks, but having less red meat is better for you. Red meat actually does decrease your lifespan. Decreasing the amount of simple carbohydrates and sugars that you get, and trying to avoid highly processed foods. So I always kind of tell my patients, if you can't pronounce the ingredients on the label, you probably don't want to eat it.
All right. Well, anything else before we close?
No, I just think, everybody out there, I think that new study that showed that just 10 minutes a day of walking is so very helpful. It's such an important thing, and I think 10 minutes a day of physical activity is so achievable for anyone. Even if you're, in your house because of the snow and the ice and everything, if you can march in place in front of your television set for 10 minutes, you're going to help yourself be healthier, and that's a huge thing.
Morris Hospital's cardiovascular specialists are your local resource for compassionate heart care, from routine concerns to complex heart conditions. To learn more about the cardiovascular specialists of Morris Hospital, go to morrishospital.org or call 815-705-1000.